Hi, I'm Dr. Beachkofsky. I can give you the psychiatry perspective on PTSD and trauma. We'll talk about some developmental stages of things and why it's different to experience trauma when you're a child versus an adolescent or an adult. Some of the stuff that's really interesting is children are constantly developing. The brain takes, about 25 years before it's done. So there's all these different stages that the brain goes through. It goes through a period of escalated growth, and then it slows down a little bit, and then there's new connections, and then it starts off by being the more anatomically tied together spaces in the brain. Those connections are the first ones because everything is already close by. As the person ages, we tend to see more of those connections that are functional. So it's no longer just, oh, I'm next door to this thing, so we're going to have a connection. The connections become more functional. So this is where there's a really big impact of trauma happening in a kid. So depending on what stage where they are in the development of having these connections made will depend on whether or not they're going to have the same sort of functionality of these circuits to begin with. So if they don't have a trauma until they're an adult, then in theory, these circuits have all been set up the way they're supposed to. So they're neurotypical setup of the circuits. But if there's a trauma when someone is 5 or when someone is 15, they are at different stages of development of these circuits. And so the presentation can be different, first of all. And then second of all, if they never develop those circuits the way that we're expecting them to, they may not have the same ability to recover from the trauma that happened. So being able to gain the skills and move past the trauma. So the fear extinguishing, all these things that contribute to the symptoms that we see in our people that are so hard to deal with. So neuroplasticity is one of the really important concepts here. So the greatest period of neuroplasticity is during the developmental years. So of course that prior to 25 years old piece, the neuroplasticity is really high. So an impact of trauma on someone very young can really impact that in a negative way. Or potentially they can overcome it if they get the treatment that they need or the support that they need. They can move past that a little bit easier. So I'll talk about this a little bit later on, but that's some of the reasoning behind using some of the psychedelics, some of the new treatments that are coming out, is to increase the neuroplasticity, and that may be part of the reason that people can have really great results with just a few treatments with some of these psychedelics. So the idea is that it increases the neuroplasticity because that's what you have when you're younger and you're learning new things. So you experience something and you learn how to deal with that in your environment. So when we talk about learning about something, so you have the fear conditioning and then we have the extinguishing. In general, even if you extinguish something as a child, it's not completely gone. The brain has some pathways that just aren't being used anymore, but it isn't completely extinguished. And there are risks of that returning if there's more trauma, if there's other problems, and if the development doesn't go as expected. So when we think of what parts of the brain are affected by fear, the amygdala is one of the big ones that come up. So that's lower down in the brain. That's the lower functioning stuff. It's not part of the executive system, and it can really take over a lot. But fear is important because that's what protects the organism in their environment. So they need to be able to take in information from the environment, figure out what to do to stay safe, to move forward, to grow up and have babies. So that's why that information can be ingrained so quickly, and it's so important for the brain. So speaking to that, of course, we need to be protected in the environment. So when kids do learn that something is unsafe and they figure out how to process that information to then stay safe, that's great because then the organism has figured out how to stay safer. But that's not necessarily going to be productive for further down the line development. Fear and stress can impact the development of the prefrontal cortex and some of the underlying circuitry that helps to manage emotions and distress. So again, in younger children, some of the biggest impact will come from caregivers. So if there's neglect, abuse, the loss of a parent, any sort of like childhood institutionalization. So these are the major things that can impact children. And so they do their best to survive in the environment, but it really is going to limit their abilities to have the same trajectory to develop the emotional regulation and the prefrontal cortex. So some of that executive functioning is going to lag behind. Now, when we're looking at adolescence, this is also a very interesting point of time for development. Adolescence has a period that's considered a sensitivity window. So in adolescence, we see a lot of risk-seeking behavior. So there's a little bit of disinhibition while there's all these new circuits that are being built. We're interconnecting some of this more functional stuff. So it's also a period of time when there's a lot of development and learning associated with the fear neurocircuitry. And of course, again, the amygdala plays a big part of this. It's sending information to the cortex so that the cortex can figure out what to do with it. And then it sends the information back to create a system of information so that we can figure out when is it safe, when is it not safe. Adolescents are highly responsive to their environment. So if there's a lot of stress happening in the environment, especially social stress is really important for adolescents. Of course, that's when they're making all these connections, whether we like them or not. And that is going to play a big role in the reinforcing of whether or not something is safe or not safe. So some of the strongest stress effects appear to take place during adolescence. And that's the time period when that stuff gets ingrained and it is really hard to get it out of the system. There are some holistic things that can be taken into consideration during this time period. So if you are treating somebody who's an adolescent and facing traumatic experience, still focusing on the basic diet and exercise, getting enough sleep and staying away from drugs. These are very simple concepts, can be difficult to manage for teenagers, but it can play a big part in the brain developing as normally as possible, even with stress or trauma on board. So as I alluded to earlier, it can be a little bit tricky to really know what's going on, what has been altered before the trauma in the first place. So there could be alterations in circuitry that lead somebody to be more likely to develop PTSD than another person who experiences the same trauma. So that's a big question that we still have that we don't have the information on. So don't let anyone tell you that we know how that works because we're not sure yet. And also to understand that even though we have some basic ideas of where these things happen in points of time in neurotypical development, this is not something that we can set to a calendar. It's nonlinear. Things happen based on what's going on in the environment overall, not just trauma and stress related. So some patients may develop problems sooner or later, depending on where they are in their cycle of development, can also indicate how bad it is or how well ingrained it is and how hard it is to treat. So, if we wonder why the fear response can be so much greater than at other stages of development or as an adult, one of the interesting things here is that that's when the amygdala volume is at its largest. So, we know that certain areas of the brain have more neurons before the development is complete. And so the amygdala reaches its maximum volume during adolescence. So, perhaps that's why the threat is so strong and held onto so tightly by the brain at that stage because the amygdala has a lot more influence at that period in time. Whereas as an adult, the amygdala has a smaller volume. It may have less impact from threat at that time. And just as the amygdala being largest in adolescence, it is smaller and less connected in younger children. So that may lead to better experience of extinguishing because they don't have as many of those functional connections between the prefrontal cortex and the amygdala. So there's less volume to the amygdala. It doesn't have those reinforcing connections with the prefrontal cortex. So it is possible that as they age, the extinction may actually be easier for a younger child that's addressed soon enough than an adolescent. This is theoretical, but that's some information that may help apply to certain cases. And then, of course, there's being able to distinguish between threat and non-threat. And that's one of the problems that the brains have with PTSD. So a PTSD brain often can't tell the difference between a threatening situation and a benign situation. It reads both as threat. So this is one of those periods of time when the brain has had a big impact on what it sees as threat versus non-threat. And so that can be a target for treatment, but also a difficult thing to undo. So understanding a little bit more about the neurocircuitry can give a client an understanding of something that's going on in their brain so that it can maybe alleviate some of that shame and guilt that they have, like, why can't I get over this? Why is this my problem? Sometimes putting the blame onto the physiology can feel a little bit more comfortable and make it easier to do the work. Again, I'm Dr. Beachkofsky, and I hope you go forth and be awesome and continue to do your thing with your therapy patients.